who died after ingesting nearly 10 times the amount of fentanyl needed to kill an adult. After digging through reports Scripps News found in the months leading up to Aviana's death, police knew her father was involved with drugs, but never warned child welfare that she could be in danger. And this is just one of the tragic cases we have seen in recent years that could have been prevented.
I sat down with national investigative correspondent Lori Jane Gliha, who did the digging into Aviana's case, and others about the breakdown in communication and the changes that need to be made going forward. And we have Lori Jane with us today. Lori, you discovered some pretty big breakdowns and those communication breakdowns between police and then those child welfare workers. Is there anything in the Colorado court system that would automatically let these child care welfare workers know when something went wrong with parents?
You would think that would be what would happen, but when we talk to the Department of Human Services, they say there's nothing in the court system that triggers them to be informed once somebody is charged with child abuse. And that's what happened in the case where the guy got pulled over. He was charged with child abuse, and child welfare workers didn't get informed about it. And this is why communication is so important. In one of those cases, it involved the Colorado State Patrol, and they did say that they had done an audit a couple of years ago on all of their child abuse cases, not just fentanyl related ones, and they did find a breakdown in the system as well. So they did additional training to kind of repair that. But the Department of Human Services says something like this would be important, would be helpful.
And you've been reporting on this now for more than a year on these types of stories. So how do you even find them?
Yeah, so we started from scratch. We look for cases in the news, for example, and then we started our own spreadsheet. So we would take the name of a child, we'd put it in the spreadsheet, we put their age, the date of the death, and we'd start seeking out public records. That includes arrest affidavits, court documents, obituaries, autopsies. We requested these things, we'd make phone calls. We tried to document as much information as we could about each case so that then we could look at the spreadsheet and see if there were any trends in this. We just kept looking for trends, things that we could shine light on that might help prevent future deaths.
And speaking of Narcan, there's some police body camera video in that story of yours where we hear those first responders talking about Narcan. They're administering it to a woman that they found, and we know and have reported on Narcan so much over the years. Is there anything else that can save or help in these situations?
Absolutely, and one of the things that we have been reporting on, shining light on, that has been effective is this idea of fentanyl testing. A lot of times when a first responder or a medical person encounters a baby or a child, the first thing that comes to mind isn't that this kid is suffering from a fentanyl overdose or a poisoning. So sometimes that just goes out the door and they try other medical interventions. But one thing we found was, and then also I should add that a lot of hospitals in their standard drug test don't test for the synthetic opioid that is fentanyl. They might test for an opiate, and so that goes out the door as well, and the kid doesn't get the treatment in a timely manner. So we have seen a lot of medical professionals starting to recommend that this test be done. A lot of hospitals have started to institute this as well, and it has become effective. And one other thing I just wanted to add is the reason why these kids are dying is because they're actually ingesting the drug. They're putting it in their mouth or they're putting it in their nose. And we've been finding another thing is some of these parents don't know that they're bringing the fentanyl into the house. They think they're using Percocet and don't realize fentanyl's mixed with it, or they'll leave their materials out, like they'll put a spoon out or the residue is out. So that's how these kids are getting it. The testing has been effective in helping prevent some of this.
Well, thank you so much. That was incredible reporting. Lori Jane with us this evening.
Thank you.